Tomi. I'm 33 years old. I had silicone removed from my butt to save my life, and now you can see my butt from the front. When I work out, I put a girdle that pulls up all the skin from the front. Then I put padded panties, and that fills up those dents that I have on the side. Over all of that, I put compression shorts so that I tuck in any scars that I have, and then I put my regular shorts over that. That's like 4 or 5 layers that I'm wearing every day. I started dancing when I was in high school. I would say I was about 23 when I noticed that all of the other dancers, they all had big butts, and they were making a lot more money than me. My girlfriend was getting silicone injections in her butt by this lady that would fly in from Florida. She was a retired nurse. We met at a nice hotel. I laid down on the bed. She pulled out a huge needle, and she had like red Kager cups that she was like filling up with stuff. And I asked her what it was, and she said like silicone, but I didn't ask enough questions. At that point in my life, I was so just like living so crazy that I thought I was invincible. The shots hurt, but I was really happy with what I saw. The bigger my butt got, the bigger my tips got. But I still wanted to go bigger, so I called the lady that was doing my injections. She wasn't picking up her phone. So I called the friend of mine that went to her, and she was like, oh no, we're not dealing with her anymore, but there's somebody else. And it ended up being a couple of women that come from Colombia. It was years later when I found out that the lady that did my first set of injections was actually in prison. The first time I met with the women from Colombia, that's when I had my boyfriend Kyle take me. He tried to talk me out of it. He told me it was stupid, but I wasn't listening to anybody. We went to an apartment. They started pumping me up. And again, I just had no idea what they had put in there. And there was a big mirror in front of me, and I just remember looking up at the mirror, and I had never seen myself so pale in my life. I called Kyle to come in, and that's when he knew that he had to take me to the hospital. I was in ICU for 2 weeks. I was in there on Thanksgiving, and Kyle tried to bring me a Thanksgiving plate, but I wasn't even... I don't remember, but I really had like a big wake-up call, because for anybody to stick with me through all of that, especially since we had only been dating for a few months, I knew that he really loved me, and I really didn't want to lose him. I was done with the injections, I was done with dancing, and I wanted to just be with Kyle. A couple months after that, my health went downhill. I knew that it was my butt. Now I wanted out. In total, I had 3 silicone removal surgeries. This is my butt. Right now, my butt caves in, and then you can actually see skin from the front. It's just like hanging. To me, it looks like I have balls. And that is what I can't deal with anymore. Now that my health is under control, getting my butt fixed is the last thing that I need to do for myself. Every single day, I'm constantly reminded of the stupid person that I used to be.
It all happened for a reason. There's nothing you can do about it. You can't take it back. You can't go back in time. So just move forward.
It makes me feel horrible because I understand why she feels the way she does. She just made some bad mistakes, which we have to deal with at this point.
That's the only thing that's holding me back at this point is I don't want to get married and have all of this going on. Kyle and I are already committed to each other, but to just have that final step and have that traditional wedding that I've always wanted would just mean the world to me. And I can't do that until my butt is fixed.
This would be our final chapter.
So I'm doing these 2 horribly complex cases on Friday. So then right at the end of surgery, my head just starts boom, boom.
Headache.
Like temple. Going, am I dehydrated? What the hell's going on? So I ended up having 2 liters of fluid after surgery.
You had him start an IV.
Oh yeah, I go like this. I have them use a little bit of lidocaine to numb the area up and then put the needle in.
You started an IV to get fluids in your body? I don't know. You ever think about a juice box? Here's someone who had a major disaster from silicone injections and has had procedures already. There it is.
Oh, cheapers.
So they've had extensive operations. Let's bring her in and see if we can help her. Your name's Tomi.
Can you please send in Tomi?
Hi.
Dr. Nassif, nice to meet you.
Hi, Terry Dubrow, nice to meet you.
Nice to meet you. I've had a lot of doctors tell me that I basically should probably just live like this and be happy, but I'm just hoping that Dr. Dubrow doesn't tell me the same thing.
You had silicone injected in your butt, I guess.
Yeah.
When was the first episode of silicone injection?
2010.
Where did you have the butt injections done?
They were in a hotel room.
So this person would come in.
She would fly in from Florida.
What would she inject in you?
One time after she left, some of the stuff had fell out on the counter, and I wanted to see what it was, so I went like that. It was like oil.
And it's most likely a non-medical grade silicone.
Yeah.
Non-medical grade silicone is industrial, something that you might use in machine parts or something like that. You don't want that injected into your body.
How many times did you have silicone buttock injections done?
By her,
Yeah.
probably like 5 or 6 times.
Oh,
By
wait,
her? You mean there's more?
Yeah,
What happened to her?
she went to jail.
Buying industrial grade silicone and injecting it into someone's body doesn't make you a surgeon, but it may put you behind bars. And then what happened? Did you stop doing it?
I went to see someone new. So these ladies had came from Colombia.
So they do it though, and then she gets sick instantly. So I rushed her to the hospital. They put her in ICU right away, and she was there for a
2
while.
weeks.
2 weeks.
Yeah.
For about a week and a half, she was kind of out of it. Like, you could look at her, but she wasn't there. I thought for a while there, I did think she was gonna stay kind of like that. And then at that point, I didn't know what to do.
Did you tell them what you had
No.
done? They had no idea?
No, this is
didn't
why I
tell
didn't.
them?
I made him promise me that he wouldn't say anything because
Why?
I thought they were gonna cut my butt out. I couldn't have that done.
So yeah, but you could have died.
I couldn't
Mistakes,
work.
That's where the whole
Living is more important than work,
Exactly.
kid.
At the time, I was an idiot. It was so dumb. I'm so dumb. Years later, I had extreme joint pain. And that's when they found out I had high levels of uric acid and calcium. My blood pressure was really high. They
Yeah.
made me go right to the hospital. That's when I met my kidney specialist.
Did they give you a diagnosis as
No,
to what?
but at this point, we're telling them, okay, look, she had these injections years ago. We think this is what it is. So finally, the kidney doctor said, let's go get some of this stuff taken out.
So it's that silicone floating around her vascular space.
Exactly.
This is the first time I've heard of someone having kidney failure following injections to the body.
You then went where to
To a
have?
Beverly Hills plastic surgeon. He took out some stuff from the bottom, but I still had all of this up at the top. So then I find a plastic surgeon in Arizona,
Okay.
and he did 2 surgeries, taking it all out.
And what happened to your health after that?
It got better.
What are your goals?
I just don't want it to look like I got attacked by a shark. And it's so,
Flat.
it even maybe indents a little on the sides.
Okay. Tommy's case represents a really scary situation. I hope I can help her, but if she has any residual silicone traveling around her body, surgery could make her situation much worse and lead to total kidney failure. Let's be honest, you're lucky to be alive. Those injections could have killed you. So let's go be afraid together and examine things and figure it out, okay?
Okay, sounds good.
I just want to have a look at the contour. I want to assess that extra piece hanging
Yes.
down. The projection component is the thing I'm most worried about. Tommy's goal may be to have more buttock volume and buttock projection, but she doesn't have enough body fat anywhere to transfer to her buttock area. And the only other way is buttock implants, which unfortunately I'm very against. Look at this, Paul. He actually has droopiness on both sides,
Yeah.
right? But one way more than the other.
Right.
Okay, now do me a favor, turn around.
Do you see how this feels like it's not even connected on my body? Like, what is that?
Is that a big granuloma?
Feel it.
Sadly, we are no strangers to granuloma formation. It's the body's defense mechanism to create scar tissue when you have something like liquid silicone injected.
Overall droopiness down there, I think can be improved. Projection, I don't think you're a good candidate for buttock implants.
No.
Buttock, your body is supercharged in its defense to silicone. Could you imagine if we put a big hunkin' butt implant in there, what your immune system is gonna do when
Yeah.
it sees that?
Remember, the whole goal right now is to preserve and improve your kidney function.
I'm a little disappointed that Dr. Dubrow couldn't give me implants so I can have that volume that I wanted. But at the end of the day, I just want to move on and have a healthy, nice life.
If you can actually elevate that floppy tissue, just to make her feel better, and maybe do the shelf, if you can get rid of that, which is also silicone, that's also going to help her from her health standpoint.
How do you feel about an additional scar that goes through your tattoo
I'm
across
okay
the
with
back?
it.
It's rare that Terry and I get in a situation where we have to remove something foreign to help with someone's health. And in this case, that's what we're doing. That's more important than anything. Cosmetic appearance comes second.
And then, we're gonna do a lot of this.
I'm so excited. I mean, he's like the god of plastic surgery, so I'm in the best hands.
Pleasure.
Thank you so much.
Nice to meet
Thank you.
you.
I am super excited. Like, you have no idea.
You don't seem that excited.
Very early. Like, come on, give me a break.
All right, Tomi, we're ready to take you back.
Okay.
I'm looking forward for Tommy's happiness. Hopefully after all this is done, Tomi feels great about herself. We finally get to have a wedding and it all comes to an end.
Tomi, how are you?
Good.
So, this is a tough case, as you know, okay? The excisional procedures you had actually improved your kidney function. What I'm worried about is I plan to move things around, and I'm hoping that I don't put silicone into the system that may affect your kidney function adversely. Tomi is entrusting me to help her, so the last thing that I want to do is to aggravate any silicone, but deposit into her kidneys, damage them further, and lead to an even worse problem that she already has. Okay, so you cool? You cool with this?
Yes, I'm very cool.
My goal with Tomi today is to try to restore her shape, try to improve the droopiness of the buttock, and that area that's down below that you can see from the front, but I'm not sure how well I'll be able to do it without having her stand up in the middle of the operation, which of course is not possible. I'll start Tomi's surgery by making a transverse incision across the lower portion of her back. Next, I'll excise as much silicone as possible, remove excess tissue, and perform a buttock lift. Finally, I'll remove skin from the gluteal area to eliminate the ability to see the buttock from the front. Hopefully, this will give Tomi a nice buttock contour. I had planned for about a 3-hour surgery. It took me 5.5 hours. It was a very difficult surgery. So I made an incision and it was just silicone everywhere, both free floating and in little silicone balls. There was actually a silicone ball where I grabbed it and squeezed it.
Stop.
Yeah.
Really?
Yeah.
Wow.
So I removed a giant segment of that silicone containing tissue, and then I lifted you up.
I'm so happy and relieved that he got more silicone out. I mean, that's really what I wanted. I want it all out if I could.
Then I had to deal with the lower part. I wasn't too aggressive about that because I can't tell you how many times I've seen surgeons lose their way because the patient's lying down, you lose the architecture, and they go over to the front in places they shouldn't be. So let's see what's cooking.
I'm a little nervous for Tomi to see her butt today because I know Tomi and I know how hard she is to please.
Okay, so first thing I just have to know, did I get rid of that? I think I did. I think it's swollen, but I think I did. But turn around, face me.
Look.
Yeah. It's hard to tell because it's gonna be very swollen. If it's still there, a teeny little tweak, gone.
If that's still there, I definitely want Dr. Dubrow to do that little tweak thing that he's talking about because I don't want to have those balls anymore. Only thing that is scaring me at this point is obviously the front.
If we do have to tweak that area, it's what we call in surgery a ditzel. A ditzel is a very small surgical procedure. It's a very small thing. That's a ditzel. This is a ditzel.
I think we're pretty much done, eh?
Thank you so much.
I've wanted to marry Kyle for 6 years. I didn't know this day would ever come. I feel like I have my life back. I'm able to finally move on from my past now. And on top of that, I have a normal looking butt.
What the doctors have done for Tomi has changed our lives dramatically. It was hard for her to ever be happy before, and she's excited and happy about life now, and we're excited to move forward.
I think Kyle's gonna be blown away to see me like this. I feel the way you're supposed to feel in a wedding dress. I feel happy and sexy and confident.
Tomi, Kyle, you two have been through a lot together already.
Kyle's stuck by my side this whole time with the surgeries and the hospital visits and all of that, and I'm just happy and excited for the future. I look forward to spending the rest of my life with you, and I'm gonna continue to take care of myself and just be the healthiest person that I can be so I can be around and be here for you. My kidney function has totally improved since seeing Dr. Dubrow, so just for that reason alone, I'm totally happy.
Do you, Tomi, take Kyle to love, hold, and support in sickness and in health?
I do. Before my surgery, you could see my butt from the front. I had to wear multiple layers to cover scarring and silicone bulges, and it made me regret my decisions. But now, thanks to Dr. Dubrow, it no longer looks like I have balls and I have a better shape than I can ask for. This is definitely the happiest day of my life.
I declare you husband and wife. You may kiss the bride.